Gentlemen, welcome. I'm Lawrence O'Toole, CEO of LJO Advisors, and we specialize in bringing in solutions to healthcare systems that improve the bottom line with low to no risk. And I'm thrilled to be moderating today's important conversation on reimagining patient collections in healthcare, and a little bit broader than that too. So if you're a healthcare system leader trying to boost revenue while staying true to your mission, or if you're just interested in AI advancements at all in healthcare, this session is definitely going to be for you. We're talking about ethical AI-powered solutions that transform bad debt into community benefit while reducing costs and preserving patient trust. In addition, we'll also be taking a deeper dive into the expansion of AI use cases in the industry with an industry expert. But before we even get into any of that stuff, why is this even important to be talking about today? Well, I've compiled a list of just 5 headlines from Becker's Healthcare, recent headlines, and trust me, there was about 20 or 30 that I could have pulled from. But let me give you a few, right? So number 1, healthcare system bad debt piles up, 5 things to know. Number 2, 52 hospitals and healthcare systems cutting jobs. Number 3, the U.S. hospital system is approaching financial breaking point. Number 4, hospital layoffs spike and threat of the Medicaid cuts near. And then hospital finance and supply chain leaders predict 15% increase in tariff-related costs. And we all know that we're going post-pandemic and even coming into this year prior to all of these, tariff-related costs pile up and all the cuts, the big beautiful bill, everything else is coming out, and all of these headlines that we're already riding as an average of about 2% for those who are of a margin, for those who are actually making money, right? So, and there's plenty that are below on that red line. So we need as an industry to pull together and try and figure out how we bring more revenue in and do that in smart, intelligent ways. And that's what we'll be talking about today, as well as some additional AI advancements too in the industry, which are pretty exciting. So we've got 2 incredible guests that I've known for a long time. Number 1, Beth Barksdale, CEO of Encore Exchange. And I've worked with her through different roles for over 20 years. Deepak Mittal, who is one of my favorite partners that I've had, industry expert inside and out when it comes to AI advancement across many industries, but especially specializes within the healthcare area, right? So once again, we're going to cover real-world strategies like AI-driven charity identification. We're going to be talking about omni-channel outreach and a one-of-a-kind give-back model that supports your community. So how many vendors who are already getting you additional dollars in the door are actually giving back so you can actually help your community, that's your local community that needs help as well. So all that is what we're going to be going over, as well as some advancements as well. So before we do that, we have a little bit of housekeeping. We'll be recording this session so you can share this after with folks who from your institution, as well as others, or you can refer back to it later. Number 2 is we're going to be taking questions. So throughout this, we're not going to be answering questions as we go, but we'll set aside a little bit of time at the end so we can get to some audience questions. So if you have a compelling question, please put it within the chat with a Q&A, and we'll be monitoring that. We'll be able to take a look at that and give you some answers at the end of this. So, and before we actually jump deep into the discussion, I'd love to give Beth and Deepak an opportunity to introduce themselves. So first we'll have Beth Barksdale, CEO of Encore Exchange. She brings decades of experience in transforming the patient financial experience with compassion and innovation. And like I said, I've worked with her for a number of years. So Beth, let's start with you. Could you please do a quick intro and a little bit about the mission that's driving your work today?
Sure, you bet. Good to be with you, Larry and Deepak, and all of you who are listening today. So I am the president and CEO of Encore. We've been in business, as Larry said, 50 years. Our hyper focus has always been in the collection space, and we have always wanted to leverage integration and technology for the very best patient experience. So we're excited to talk to you today about how we can help you bring in more revenue in smart, intelligent ways.
Yeah, and Beth, I love that you brought up the integration piece of it, because as far as I know, when I worked back at Meditech and ran our strategy and our partnerships, you were the first in the market from a collection standpoint that actually had an interface directly within EHR, and you did that also with other EHRs as well. So you guys were really a pioneer in that that space.
You're speaking to my age a little bit. But yes, I can remember those days. And we were the pioneer, and this was back in the late 70s, early 80s.
Yeah. Talking my age too, so we're all in the same boat here. So, also Deepak, yeah, I've worked with you for a number of years now, and my God, I don't know anybody who's more well versed to talk about AI. And just so you know, it's not just a relationship where I go to you for some intellectual property and try and pull some things out of you. But we've done some interesting projects together in the market, where we're listening very deeply to hospital systems and listening to their problems, and then putting our heads together and trying to figure out how do we solve this by using advanced technology. But if you don't mind doing a little introduction to yourself and a little bit of your background, what drives you and your company.
Sure. Thank you for having me here, actually, Larry, and great to be with you, Beth. I'm CEO and founder of NextGen Invent, and NextGen Invent is a AI data science and technology services company. And my passion has been is how I can actually transform organizations into AI-enabled organizations so that they can actually reap the benefits of it to add the value to themselves, to healthcare outcome, and also to the patients as well. I have been advisor to various companies who grew from a startup to unicorn, or actually lead the think tank panel of various CMO and CIO of healthcare companies, where we discuss actually about how what are the challenges industry has and how we can actually solve them. Regarding the NextGen Invent, we basically differentiate ourselves in 4 different ways. The first is actually our deep AI expertise. The second is how our thought leadership and industry experience can bring insightful perspective for our client. The third is actually be able to have the innovation in action, is whatever your strategic bet is within the organization, how we can accelerate that through the innovative solutions itself. And the fourth is actually accelerated value delivery, which is also doing the accelerated development to get those solutions out to you in a shorter time and with guardrails, AI guardrails in place, so that you are not blindsided with that as well.
Excellent. Well, appreciate both of you joining today. It's a really important conversation. So, and once again, just to really frame it out, it's like today we have an exciting announcement really from Encore Exchange and what they've done, not only with advanced technology, but also how they're leveraging it and the program itself. It's really people, process, and technology, right? So we're going to dive into that, and then as you can tell from Deepak's experience, we want to dive in a little bit more of like what other use cases are we seeing. If you don't watch the news for a week or two, you're already missing stuff. This is just moving at light speed. So always like to check in with Deepak and figure out what is happening next in the market. But let's dive right into this new announcement, and we can break it up into a number of questions, Beth. But I'm super excited about what you guys have been working on. But let's just start at the very top, right? So medical debt in general, and where has that been transforming the marketplace? So medical debt obviously is a significant complex issue. It really is, right? And what shifts from your seat, and you've been doing this a long time, right? So what shifts do you see in healthcare landscape that impact revenue cycle, billing practices, and collections overall?
Sure. And I think that's a great place to start, because if you've got a great solution, it's solving a big problem. So we can go all the way back to healthcare being a heavily regulated industry beginning in 1977 with the FDCPA, and coming forward to something as recent as 2022 in the No Surprises Act. And all between there, we could list pages and pages of regulations that help ensure we are in compliance as healthcare providers. Or services vendors. And most recently, we've seen those laws and regulations focus more on the patient as a consumer and ensuring that that patient is protected really from 2 things. One, to make sure that the amount owed for their services is coded correctly and communicated well, and most importantly, that the medical debt doesn't place undue harm on the patient. And what this has done, this focus, is